Welcome back to the Doctorates Talk Show. We're here to raise your awareness about healthcare in the community. I am your host, Jennifer Leslie, and I'm with my co-host, Dr. Katherine Ntekim. So, Dr. Ntekim, what is going on? We're finding out that people are actually committing crimes so that they could go to jail, so that they could get health care. Is that for real?
That is absolutely real.
Well, how comes?
One of the major problems with health is the cost. Cost of insurance is a major problem that causes people who do not have insurance to commit crime to get proper health care in the jails.
So, the major problem in accessing health care is cost. Is that correct?
That is absolutely correct.
So, let me see something here. So, if I don't have any money and I'm really sick and I want to get some care, why can't I just go to the hospital?
You can't go to the hospital because they are required to take care of you at the barest minimum. Yes, you can do that.
Okay, so we're missing out. Tell the audience what's going on, because I'm totally lost. I know that for a fact that people have been committing crimes just so that they could go to jail and then go just to get health care. So from the need to have health care to jail for health care, it's not adding up. Now, you work in the prison system. I know that for a fact. No, the correctional facility. Right. I know that for a fact. Right. So you're basically an expert in the field. What we're talking about here, is it all adding up and does it make sense?
Actually, it starts with a person getting sick, going to the emergency room.
Does it make sense or not?
It doesn't make sense in actuality. However, people who get sick go to the emergency room, they get the basic health, and they're told, go to your primary care doctor. Unfortunately, they do not have a primary care doctor because of costs. And so they commit crime so that they can get the primary care doctor in the jail or in the prison.
Okay, so not everybody, obviously, who gets sick goes to jail for health care. Only the people that can't afford it. But even if you can't afford health care, you can still go to the emergency room. More likely than not, if you're sick, they will not turn you away. At least they're not supposed to. But what happens, as Dr. Ntekim is saying, that if you're not in need of emergency room care or no further emergency room care, you're then discharged home. Okay, see your doctor tomorrow, follow up with your doctor. That's where the problem lies. Because, so you'll find these people that keep going to the emergency room. Is that not right?
That is absolutely right. They go
so
to the
tell me, how does that go?
They keep going to the emergency room, they get the basic care, but they are to follow with their primary. However, having
primary what?
Primary doctor. However, not having insurance to pay for the primary doctor, their illness continues to grow, it gets worse, and they end up back in the emergency room.
Yes, but
and there's the cycle.
Okay, but if you don't have insurance, you can pay, it's only what, $75? $125? Is that not correct to go see your doctor?
Medical care has skyrocketed so much so that even a little bit of expense can add up over time.
I got it. So you're discharged from the emergency room. you go to see your doctor, and you get a bill, right?
Right.
So you're saying that it's not just for the visit, but it's for other costs, right? The lab work,
Yes.
right?
Yes.
Other tests,
Yes.
right?
Yes.
Okay, so it mounts up.
Yes.
So it's not just the $50 or $75 or $125, right?
Right.
Okay, so now, in answering the question I asked you before, so no, it doesn't make sense to commit a crime just to go to jail for health care, but how about if you're really sick? How about if you have cancer and you need to have surgery and you have no insurance?
I have an experience in that people have been known to commit DUIs. They get arrested. They come to the clinic in the jail. There you find a terminal disease that has been diagnosed many years before, but they could not follow up. And these are some of the reasons that they come to jail, so that that treatment can be started.
Okay, so you may have somebody who has been in and out of jail, right? In the hospital, they call them a frequent flyer.
Right.
I don't know what they're called in jail, but they come in and they go out. They come in and they go out, right?
Right.
But they may be suffering from a chronic illness where they need to have surgery. They know that they need to have this surgery, and so here comes the police, pull them over. There's a warrant. They get arrested. They go to jail. Opportune time, because now you need surgery. You knew all along you need surgery, and
Right.
this is the time that you're able to get this treatment.
Right, absolutely. The jail health system is just as good as the health system out there. However, it's free because they're incarcerated. And it is at this point in time that we would need to work up that chronic illness, that diagnosis, and begin the treatment process free to the person.
Okay, so if someone with cancer, for instance, who needs to have surgery, and they commit a crime, deliberately commit a crime so that they go to jail. By the way, isn't that illegal in itself?
Not to the person who knows that they need the health care but cannot access it on the outside as a free person.
Okay, so when you are choosing to have surgery in jail, is it okay to say they're choosing life over death? Because, okay, as a patient, I could say, well, I'm not a criminal, but I have cancer, I need to have my surgery, and I know that if I am in jail or in the prison system at least, I'm going to have my surgery, and then my grandkids will be able to see me. I'll be able to see my grandkids from prison. However, if I don't get the surgery, which I won't get anyway because I don't have the money, I don't have the insurance, then
You could die.
I'm risking my life. I'm gonna die, and I won't see my kids. I won't have a life. So basically, do they really have a choice?
They really have a choice. Everyone has a choice of living or a choice of dying.
They're choosing to live. Is that not correct?
They're absolutely choosing to live.
So by choosing to live, you have to choose to go to jail. Because this is America, this is the healthcare system, this is how it works here.
Right.
Is that not correct?
That is correct.
I am feeling disgusted. I'm feeling disgusted not only because I'm listening to you, but I sneaked and did a little research.
Okay.
I knew that you were the expert, and I was going to be interviewing you and getting my questions answered, but I wanted to really do a little bit of research, And lo and behold, I found a lot of cases where people have in fact committed crimes just so that they could go to jail, just so that they could get their surgery done or their health care for free. This is the healthcare system that we have here in America. This is the system that we live in. This is America. We need to pause for a moment because we need to absorb this. We will be right back. And we are back on the Doctorates Talk Show. We're here speaking with my co-host, Dr. Katherine Ntekim, who is enlightening us on the prison healthcare system, the correctional healthcare system, the jail healthcare system. Jail care, what difference does it make?
Nothing.
All right. So what we've been talking about is why anyone would possibly choose to commit a crime just to go to jail for health care. And we had to decide whether or not it made sense or not. Now, but you didn't quite convince me, Dr. Ntekim. Yes, I know I did sneak and do a little bit of research on this. And based on my research, I do know that there are some cases where that occurred. But do you know of any cases personally where that has happened, since you are in the prison system?
Absolutely. I have quite a few patients that come through the jail that have had terminal diseases diagnosed, but are unable to see their primary doctors because they have no insurance, no way of paying for the treatment.
Okay, what do you mean they come through, patients coming through the jail? Are you saying that once they get arrested and they come into the jail system, you get to see these patients?
Yes, we do.
And you're already familiar with their healthcare background because they're already in your system?
A lot of times you have to realize that the jail system, the correctional health system in America is better than a lot of cares in other parts of the country.
How so?
A very good health system is set up in the correctional system for the people that come through. People have been diagnosed with breast cancer. They have a lump. They have no money to follow up with their doctors. They come in. Once they hit the system, we have to take a detailed history and physical. Begin the workup, looking to make sure that they get the treatment plan as is expected.
I can't believe what I'm hearing. It almost like want to sound like it's a poor people crime, because if someone really is so desperate that they have to commit a crime just to get health care, that's really desperate. That's a poor people crime, because really and truly, somebody is wealthy with money don't have to do that. They already have insurance or they have money. So they do have a choice. But you're saying that a lot of poor people don't really have that choice, right?
A lot of poor people do not have the choice of where they go get care. But once they come through the jail or the prison system, they are treated just like they would have been treated on the outside.
In terms of I would say the groups or different categories of people that come through that's affected in that area, what would you say, what groups of people?
Actually, the people that come through, even those people who have insurance, there are people who shy away from going to their doctors. But once they come through the jail, the prison system, they do get initial history and physical examination. We do not differentiate the poor from the rich because the healthcare is there for everybody.
Would you say that minorities are more affected in this case?
Well,
when I say affected, would you say that there are more, you're finding out that there are more minorities that are turning up, committing crimes, turning up in the jail, that are chronically ill and need care?
You could really say that, yes, that the minority people are more in need of this health. However, it's just the number of minorities that are arrested that we see, not necessarily because those that are not minorities that get released upon arrest do not come through the health system. However, whoever comes through, whether you're poor or rich, you are treated the same way. You're getting the same health treatment as anybody else that is in there.
Okay, so you would say, is it a higher percentage of
Yes,
blacks?
absolutely.
A higher percentage of black
Hispanics.
women versus white woman, Hispanic woman?
Yes, absolutely. The health system in the jail is not any different from the health system out in the free world. We treat everybody as they come through. We have had an example of some people who, as you were alluding to, people who commit crime just because once they get released and they're told to go back to their primary doctor, they have no doctor to go to, they re-commit crimes.
Okay. So can I ask you about where does the system fall in terms of taking care of these people who cannot afford to purchase health care, who cannot afford to purchase health insurance? Wouldn't those people, those are the people I would say they're not entitled to Medicaid or Medicare, because wouldn't you say that a lot of people who cannot afford health insurance, they're entitled to Medicaid or not?
To be perfectly honest with you, all the states administer the Medicaid system differently. Everyone is expected to get health care, whether you can afford it or not. However, because life is not fair, everyone is not getting what they're due, some people are able to access this insurance, and some people are not able to access the insurance, hence the inability to get care in itself.
This is flabbergasting. Now, what would you say or suggest to anyone as to how you could resolve this problem? Now, this is obviously a systematic problem.
Yes.
It's America's problem.
Yes.
It's the system's problem, right?
Yes.
And we are in Florida. It's Florida's problem.
Florida's problem. However, a lot of people do not realize that the community health centers in the areas where they live at is a free access. A lot of people do not realize that they can go get help in the community health centers. They also have free clinics.
Hang on. Aren't those for the minor illnesses, though? Now, we went from minor illnesses to chronic illnesses to even illnesses such as cancer where you need surgery. Now, clinics,
Right.
in my opinion, or from what I know, does not perform surgeries in general, do they?
They may not perform surgeries, but they do referrals. Once they do a referral to the appropriate centers that do surgeries, they will get it because it's as coming to jail to get care, because these are the same centers that we refer our patients to. We do not do surgeries in the jails, but we do referrals. And so if you were to need care, you were to need surgery from the community health center's perspective, they will refer you to the appropriate center.
So what you're telling the public is that for those people who are used to committing crimes just so that they could go to jail and get care. You don't really have to do it. That is really not the answer.
Absolutely.
Okay.
Absolutely. You do not need to commit crime to get health care. Health care is there for you. You need to learn to find out where the resources are in the area where you live at.
I think that I've done a bit of research myself, and I think I know a little bit about health insurance, and I've seen where it's been very difficult for people to actually get surgical services for free. So we're going to have to talk about that some more. But we hope that we have raised your awareness today about healthcare in the community, about the healthcare system in general, and healthcare in Florida. I am Jennifer Leslie, host. My co-host, Dr. Katherine Ntekim. We are on the Doctorates Talk Show. Please watch our show on hbctv.org, or you may contact us at office@hbctv.org. Thank you. And we're back on the Doctorates Talk Show, the show that raises your healthcare awareness. We want to end by letting you know that even though many people do commit crimes to go to jail, to get healthcare, that you do have a choice. You do not have to commit a crime to go to jail for healthcare. In other words, you don't have to go to jail just to get access to free health care. So, the next time you go to your doctor or the clinic, ask them to refer you to the community health center where you can get access to social services, social workers, or a case manager. For now, thank you.